Yeah.
We're going to talk a little bit about what happened with the Trump administration and this Mayhow report that just came out. That's the Make America Healthy Again report. They were citing non-existent scientific studies. There's new evidence that the White House's Mayhow report, Make Our Children Healthy Again, which is the full name of it, relied on scientific research that did not exist. This is from MSNBC. After Trump and his White House team unveiled this report, the New York Times noted that the document echoes talking points Health Secretary Robert F. Kennedy Jr. has been championed for decades. And this was among the obvious red flags. Kennedy, of course, is notorious for pushing false information. With this in mind, nobody was surprised that the White House report started crumbling under scrutiny, and this is exactly why we need a free press. The Washington Post reported that some of the report's suggestions stretched the limits of science, medical experts said. Several sections of the report offered misleading representations of findings, and this week, they actually studied this document further and said that they misinterpreted some studies and cited studies that didn't exist. And I'll give you an example. The administration's document listed epidemiologist Katherine Keyes as the first author of a study on anxiety in adolescents, except she didn't write it. And so this is just some of the alarming things. And like people were saying, given Kennedy's track record, there's no reason to assume that he would understand this. Some of his claims included that Wi-Fi caused leaky brain. And of course, anything that he says should be met with skepticism. I hate this man so much, Desmond. Every time we talk about public health, my blood, I literally have to do like breathing exercises afterwards because I get so worked up over the harm, the blood on this man's hands and the whole regime and everyone that confirmed him to this position, well knowing that he was absolutely unqualified for this. That's like saying, hey, my car needs a mechanic. I'm going to go take it to the barista to fix it because I don't trust mechanics. You know, like it doesn't make any sense to me. What did you make of this, that they were so blatant with these citations that aren't even from real studies?
It's par for the course, Natalie.
I know.
It's unfortunately par for the course. You know, we are dealing with an administration, a regime that does not care about the truth.
Yeah.
They don't. I mean, Trump proved that the first time around. This was Trump 1.0. Does not care about the truth.
Yeah.
You know, it sounds like a broken record, but this is just about just imposing your will on society. Right? Mm-hmm. Like, how can I, you know, what do I have to say in order to get the result that I want? What do I have to do in order to get the result that I want? You know, like when they changed, we were talking about this, you know, the last couple of times that we've been on lives together, talking about the changes in the guidelines for, you know, the COVID vaccine, talking about like their reasonings for not showing different like CDC information. Like they don't provide reasoning for why they do what they do. And then when they do provide reasoning, it's false, right? So this is the behavior of people who believe that everything that they do should not be questioned. And if it is, they're just going to say to you whatever they think they need to say to you in order to get the conversation away from them, because they don't even feel like they have to give you the truth. And they're still going to be able to get what they want from all of this. So I see this as a bigger problem than just RFK. This is a bigger problem than just the public health sector. I mean, this is endemic across the entire administration. Like we are dealing with a current, you know, like regime that does not care about anything other than what they want to do. The end. I mean, look at it across the board. Doge shouldn't exist. Does. These tariffs outside of Trump's boundaries. Does them anyway. They have no legal authority to send people to slave labor camps in El Salvador. We're doing it anyway. You know, like just look across the board. It doesn't matter, right?
Yeah.
Like whatever they want to do, they're going to do. And so I do not know what will happen next. But yeah, RFK Jr. should never have been in this position. And it makes no sense to me that he is.
Amen to everything you said. And I just want to add to, you know, I think the reason that we've gotten to this place is because we do not have universal health care. And the reason I say that is because over the last 30, 40 years, there has become such an erosion between the trust between patient and doctor, because doctors are completely overworked, completely burned out, can see you for 5 minutes, you know, gives you the same sort of diagnosis and in and out, in and out. And so you have this breakdown in trust and understanding. And so more and more patients were saying, I can't trust my doctor. I'm not being supported. I'm not being helped. I'm going to go look for information on my own. Or I can't afford this procedure. I can't pay for this. Even though I've been paying for health insurance, I still can't pay for this. So I'm going to go see if there's a natural solution. And I'm not discounting naturopathy. I think there are certain values that can be found in alternative medicine. I'm a huge proponent of that when indicated, but also when indicated that you need to go see a doctor and go get an actual prescription for something that might help you. And the fact that we've had this huge breakdown in this relationship and have built up all this mistrust on both sides, it is no surprise to me that the level of disinformation that has spread because we do not have a functioning healthcare system that covers everyone for everything, is why we've now landed at this point where we have this criminal running the HHS. And as we round this out, I just want to add, CBS had this story that, speaking of, RFK Jr. and the nonsense, where he just said 2 days ago in a public hearing that, yes, we're no longer recommending, the CDC is no longer recommending COVID vaccine shots for pregnant people or children, healthy children. Now, head swivel, the CDC says that kids may receive COVID vaccines. This is from CBS News just earlier today. I had to read this twice because I was like, wait a second. They just said that they weren't recommending them, and now they are recommending it. They're saying CDC is calling it a shared clinical decision-making recommendation for children, means that health insurance companies will continue to be required to broadly cover the shots for this age group. And who knows who made a phone call? My guess is somebody at one of the big pharma companies was like, I don't think so. We want our bag. Whatever the reason may be, this is a good decision. Children should be getting COVID-19 shots because we very much know that COVID, in particular in children, has caused a huge array of issues, and many children are suffering from the impacts of long COVID. But this astounded me, and this once again adds to the confusion and the mistrust, because we're saying one thing, we're doing another. We're saying one thing, we're doing another, and we're doing it in rapid time.
There is obviously dysfunction at, underneath HHS, which no one's surprised with RFK being the head of it, but there's obvious dysfunction. We don't really know what's going on there because you issue something one day and then the next day you're saying something completely different. It kind of begs the question, is that, who's actually running this department? Did RFK make this decision one day and then somebody else is making a decision another day? Is he going to come back the next day and usurp that decision again? Or like you said, did some company kind of come in, like Pfizer, Moderna, someone come in and say like, hey, like we can't be having this. You got to make sure that this isn't the case. Like whatever the case may be, I think the bottom line is that there is no real organization at the, at the HHS level right now, whether we're talking about the CDC, the FDA, whatever the case may be. And that is a terrible thing for the country as a whole. These organizations are way too important for there to be dysfunction happening at these top levels. And we all rely on these organizations to be able to do things well. And honestly, it's a little troubling to me that something as important, as these health guidelines is being mangled to this point. If you were going to make decisions about this, something that people, when they go to the doctor, this is something that's incredibly, important to everybody. You walk into a doctor's office, you're expecting to get, very good advice from somebody who's had years and years of experience, and you are relying on them when it comes to telling you whether or not you are making a good decision for yourself or for your children. And these doctors rely on the CDC in order to inform all of us, right?
Yep.
So I think that when it comes to who is heading these agencies, it is paramount that if you're going to make a decision, that you absolutely know why you're making that decision. And if you are backtracking on something, then very next day, it's obvious you never knew what you were doing in the first place. This is a huge problem.
That part. Yeah. I know we've gone long tonight, and I appreciate everybody that's joined us. I just want to add, they are all practicing. RFK Jr., the private insurance industry, they are all practicing medicine without a license, right? Like, he does not have a medical degree, and yet he is trying to be up on this stage telling us when and if we're even allowed to get a shot that could help prevent us from transmitting or suffering the effects from a debilitating and deadly airborne virus, right? These are people that are saying, no, you can't get that MRI. I'm your private insurer. And no, you don't really need that procedure, going against your doctor's wishes, right? So once again, it's like we have kind of lost the plot here. What is the point of a civilization if we don't take care of one another? And I know that sounds woo-woo, but I keep meditating on what is the purpose of government. And the purpose of government is not to make a few people wealthy and to let millions of people suffer. In my opinion, from my perspective, a civilization cannot continue on that way. So either our civilization dies out, or we course correct and start implementing policies that support the many and not just the privileged few, who, by the way, are going to be fine and under really any governmental structure because they can buy their way out of it. This person said, my friend died because his insurance wouldn't approve Humira for him when it was an experimental drug. I'm so sorry. They are one of millions of people that have died because of these insane decisions being made by health insurers that have no business telling you what you should be able to do. That should be a decision between you and your doctor. If my doctor were to approve something that I needed, then I should be able to get it. Period. Like should be kind of the start and end of it. I'm at a total loss here. I'm at a total loss. And so we need to start figuring out who we want to be as a people at the heart of all of this.
Thank you, Winter, for sharing that, by the way. That's got to be a really hard thing to relive in your mind as you're kind of typing that out. I've also had friends who have passed away, unfortunately, because of illnesses that they should not have passed away from. So it is, it's the whole system is problematic for various reasons. And it's one of the driving factors, the reasons why I want to be involved in this work is because I think that when we are not talking about it, when we are silent about it, when we're not in community discussing what's going on, what needs to change, I think these things only get worse. So really appreciate everyone being here tonight, for coming through all these different topics with us. Appreciate everyone who's dropping comments, leaving hearts, people who are subscribed to us. We will be back next week with another live. I'll
have a new ring light.
For the love of God.
I really thought it was fixed, and it wasn't, guys. It wasn't. So, here we are.
Yeah.
We're making it work.
For those who came in late or didn't see everything, the playbacks will be posted here on Substack. You'll see them on YouTube with a few extra edits on them. So check us out on YouTube and on Spotify. Usually a couple weeks later. We're a little behind on Spotify right now. Make sure that you're subscribing to Natalie's Substack. You can do so at the top of the screen right now. If you're watching the playback, the link to her Substack will be in the episode description. You can click on that now. You should see her Substack link there. And her Instagram as well, for those of you who are still on that platform. She is trending up on Instagram right now.
Trying, you guys. No, we really appreciate all of the comments. And Desmond, I just love doing these lives together. I know they can be a little wild at times, but I think we covered a lot of really great stuff. And
we did.
It's really important. I'm really glad what you said, because I used to be a social worker in my previous life. And when I decided to become a journalist, you really can look at journalism as a form of social work. And I really think what we're doing here is important to continue to spread news that is both informative and gets people to think about the kind of world they want to live in and have their children live in.
Yeah. So someone says on the comments right now, how do I follow? If you click the top of the screen right now where it has like my name and Natalie's name kind of like scrolling on the top left of the screen right there, you click on that, you should be able to hit the subscribe button right there and subscribe to either one of us. Thank you, everyone, for watching. We will be back next week with another episode. episode conversation. I'm not sure.
Maybe two. We might do two next week.
We might do two. But either way, just be sure that you are subscribed so you don't miss it. There'll be a push notification sent to you soon. Thank you, everyone. See you next time.
Bye, everybody.